All right. Good morning. Good morning. Welcome to Grand Rounds. We can barely contain the excitement in the room. We're going live. And this is a really special Grand Rounds event, as you will hear in just a minute. My name's Mary Leonard. I'm chair of the department. It's my pleasure to welcome you this morning. And we will start with our Mwek Mohana acknowledgement, the university land acknowledgement, as always. And then please take a note of some of the information on the left side of the slides, just around some housekeeping for MOC and CME credit. Okay, so in a moment you're going to hear an incredibly important topic. The House believes that interviews for pediatric residency should remain in the virtual format. I will say that the Association of Pediatric Program Directors, the Association of Medical School Pediatric Department Chairs, this is an area that is very much an active topic of conversation. So we will be excited to hear the outcome of this. And then I want to call your attention to the next two Grand Rounds. Next week, we're going to hear from Jennifer Romano, who's a pediatric cardiothoracic surgeon at Michigan. I think the last I was reading about her online, there's less than a dozen women pediatric cardiothoracic surgeons, and shows she's going to speak on a plumber's perspective on the leaky pipes. Some of us will be away at PAS, but I'm thinking we should have a viewing of this video, all the women faculty in particular, and trainees. We should think about a way to follow up on that Grand Rounds. And then incredibly important topic on the pediatric workforce and how we address the nation's overdose crisis. And Dr. Hadlin is the chief of adolescent and young adult medicine at Harvard. So looking forward to that as well. And then we want to make sure you know about upcoming MCHRI seminars. The Maternal and Child Health Research Institute has a wonderful education committee that puts together these seminars. And these are two phenomenal topics. Just 2 days ago, we hosted California Surgeon General, who is an obstetrician gynecologist, and we spent the day focused on some of the work that's being done here at Stanford around health equity. And the team shown here are really doing important work, including Eero, who's a maternal fetal medicine fellow funded by MCHRI, to getting her master's and doing her work on iron deficiency, anemia, and pregnancy, and very much around health disparities. Yesterday, we're still levitating. It was a wonderful pediatric research retreat. Thank you to Allison, Serena, everyone that made that possible. And then it's my great pleasure to announce the awards. We ended the day yesterday with the poster session. So we have, first of all, we want to celebrate here the folks that gave the outstanding oral presentations. They were really quite extraordinary and ran the spectrum from very fundamental basic science discovery to a quite disturbing talk on the profile of mass shootings and their impact on children. So it was an incredibly moving and inspirational day yesterday. And then we had over 100 abstract submissions, and the shown here are our 20 poster finalists. We had a real structure for how we moved around and gave each of the poster teams a chance to present their research to us. And then, now drum roll please, the best poster goes to, thank you. So we have the 10 here, and the top 5 are the basic scientists, and then all the many other disciplines that were represented. So we're going to pause and give everybody in the room a chance to take a screenshot, take a photo, and then we'll make sure to circulate these and celebrate these. Really wonderful, a wonderful day. All right. So with that, I'm going to pass it on to Ryan to introduce the resident house staff debate.
Okay, good morning, everyone. We are so excited to be here. I'm Ryan Leone. I'm one of the pediatric chief residents, and I'm here with Liz Wynn and Jen Sedler, my co-chiefs. Like I said, we're so excited to be here, and we'll shortly introduce our speakers. But before we do that, the context of why we picked this topic with COVID-19, we really just drastically changed the way how we conduct our residency interviews and shifted entirely to virtual interviews for pediatric residency. And this has been in accordance with our guidelines from our national body, the APPD, Association of Pediatric Program Directors. And we selected this topic because in this now more post-COVID era, we in the community of pediatric training have to be really thoughtful about how we go forward with our residency interviews. So before we introduce our speakers, we'll take our initial poll. So if everyone in all settings could scan this QR code and take a minute to vote. I'm gonna not share the screen, but just to note, we're at 72% for pediatric virtual format or interviews in the virtual format and 28% in person. Okay, I'm gonna pass it off to my co-chiefs.
All right. Good morning, everybody. We would now like to introduce our delegates for this morning's debate. So on the pro side, we have Dr. Lisa Umeh, who completed her undergraduate bachelor degree at UC Riverside and then went on to complete her MD degree at Howard University. And we have Dr. Natasha Abadilla, who did both of her undergraduate as well as medical school training and now residency here at Stanford. Dr. Lisa Umeh is one of our PGY1 categorical pediatric residents, and Dr. Natasha Abadilla is one of our PGY2 Peds neurology residents.
And on the con side, we have Dr. Aydin Zahedivash. Dr. Zahedivash is a third-year resident who's a graduate of the University of Texas at Austin for his undergraduate degree and then stayed at UT for his combined MD MBA. He's also one of the rising chief residents. And then our fourth and final member of the debate today is Dr. Beth Yan, who's a first-year categorical pediatrics resident. She obtained her bachelor's degree from Wheaton College before moving to New York to pursue her MD at Albert Einstein College of Medicine. We will begin with opening remarks for up to 10 minutes with the pro side. Dr. Abadilla and Dr. Umeh, you may now begin.
Thank you, Chiefs. Ladies and gentlemen, we are here to speak to the importance and significant advantages of continuing virtual residency interviews. The COVID-19 pandemic brought upon many changes to medical school education, including how residency interviews are conducted. As our country loosens the strict limitations we were under during the height of the pandemic, having thoughtful discussions about virtual versus in-person residency interviews is of utmost importance to consider as we move forward. By continuing virtual interviews, we can create a more equitable, diverse, and environmentally sustainable interview process while also saving valuable time and resources.
Thank you. One of the strongest arguments we have for keeping residency interviews virtual is the opportunity to create an equitable environment for applicants. Equity refers to fairness and justice. More specifically, equity means recognizing that we do not all start from the same place and acknowledging that adjustments have to be made for fairness. Virtual interviews offer equity through significantly reducing the financial burden of current residency interviews. To attend in-person interviews, expenses include, but are not limited to, airfare, accommodations, overnight accommodations, dining, as well as fuel, ranging from $4,500 to over $10,000 per recruitment season. This cost is burdensome since 73% of medical student graduates with debt already incur a median of borrowing of $200,000, as reported in 2019. Overall, by decreasing resident interview-related costs, not only lowers the financial burden, but also addresses the mental health stressors that follow. One can argue that decreasing the financial burden also promotes medical school wellness and equity of life. This discussion of creating a more equitable environment also extends to the realm of accessibility and overall convenience. The ability to interview in the comfort of your own home or geographical region of choice possesses many benefits. For example, applicants that identify with mental or physical disabilities face additional stressors with coordinating the logistics of travel. Thus, conducting interviews from home not only reduces these associated stressors, but also gives applicants more control over their visual representations. Applicants can prevent or avoid traditional stigmas and better highlight topics that they choose. Similarly, applicants that identify as parents, virtual interviews reduces the amount of time spent away from home, and thus again making financial burdens and coordination stressors of childcare minimal. Additionally, applicants that are pregnant, virtual interviews also extend the option of withholding their pregnancy status and inviting pregnancy or family planning related questions if they so choose. Lastly, this courtesy can be extended to breastfeeding parents and mothers, as virtual interviews reduce having to transition to bottle feeding methods if parents do not choose to do so. As pediatricians, I believe this is our duty to be cognizant of how the child-parent interaction has been positively impacted by virtual interviews.
Given these advantages that Dr. Umeh already mentioned, one can see how virtual interviews can lead to more diversity in residents because of enhanced equity and accessibility. Additionally, on the other side of the interviewing table, virtual interviews offer programs the unique advantage of better showcasing the program's diverse faculty and staff. The virtual format allows for greater participation among clinical and research faculty to engage with and interview applicants because they don't necessarily have to be present on campus to do so. For example, Dr. Bonnie Maldonado doing research in Mexico won't prevent her from tuning in virtually to contribute stories from her experiences and area of expertise to our applicants. More faculty and staff participation facilitates a more diverse group of interviewers, which in turn helps to reduce unconscious bias during the hiring process by allowing for more diverse viewpoints. Furthermore, virtual interviews are better conduits for showcasing a residency's various rotation sites. It's quite the experience to enter LPCH Maine and ascend those grand steps into our hospital, yes, but in-person interviews limit applicants to only experience the beauty of Packard. When interviews are done virtually, more time and attention can be given to the incredible offsite rotations we offer residents. The ED in Valley Children's in Fresno, the PICU and PD wards at Santa Clara Valley Medical Center, the CCP at Packard El Camino, and the hospitalist elective at Watsonville, just to name a few. When we have a program as strong and diverse as ours is, why focus on showcasing only one site when we have such a variety of amazing offsite locations too?
Thank you for those points. Another compelling argument for virtual interviews is that it allows both programs and applicants more flexibility and efficiency in their time. Both parties equally benefit from the substantial amount of time saved in the virtual space. The fourth-year medical student, a time where one can argue is vital for medical students to hone in on their clinical skills, participate in away rotations, complete sub-internships, and enjoy having time off, which is greatly fragmented in applicants' time being traveling for in-person interviews. The convenience of joining on Zoom at a program that is several time zones away allows for, with the click of a mouse, the flexibility in scheduling, which is invaluable. Additionally, being able to more quickly travel virtually to interviews may theoretically increase applicants' chances of matching successfully. The gift of time particularly benefits applicants who may have families to care for, work separate jobs, may have to attend medical or mental health related appointments, or other responsibilities that are outside of medical school.
Finally, we would be remiss to not mention the positive environmental and public health effects of continuing virtual residency interviews. In 2020, a study published in the Journal of Graduate Medical Education estimated that in-person residency and interviews in 2019 generated almost 11,000 metric tons of carbon dioxide emissions. That is equivalent to the annual greenhouse gas emissions from over 2,000 vehicles, based on estimates from the EPA. Additionally, as this is an audience of pediatricians and pediatric health professionals, we know all too well how more travel and more exposures to large crowds equals more potential spread of communicable and infectious diseases. There were 42,549 applicants in the most recent match. And while this number may be small compared to the total population of our country, it is not insignificant when considering that many people could have been traveling and asymptomatically spreading RSV, rhinovirus, or any of the other infectious diseases we see affect our patients every day as healthcare providers in this hospital if residency interviews were in person.
And in closing, virtual interviews highlight several advantages that support applicant equity through significantly reducing financial burden, increasing accessibility, and improving overall efficiency. Also being mindful of the environmental footprint and our collective influence on public health. Thank you.
Okay, we're now going to pass it over to our other side for their opening remarks. They have up to 10 minutes. Take it away.
Thank you so much, Drs. Umeh and Abadilla. While Lisa and Natasha brought up some excellent points, we strongly believe that the feel of a program, the unreliability of virtual interviews, and the necessity of holistic and equitable application review necessitate the return of in-person interviews. Firstly, we believe that in-person interviews allow programs and students to experience the feel of a program, something that is impossible to convey virtually. Quite frankly, the match is a high-stakes operation, both for applicants and for programs. Applicants, think about it. You're offering up nearly everything to the whim of the match. You're gambling things like proximity to loved ones, housing, established community, and you're often dragging partners along on an intercontinental roller coaster that is medical education. Programs, you are agreeing to send out dozens of multi-year employment contracts based on the results of this algorithmic match. And ultimately, we know that the match is an unpredictable process. The rank list, both for applicants and programs, is the juncture where you have the most control over final outcome. It is in both parties' best interest, thus, to have comprehensive information about their options before committing and locking into a ranked list. But it is near impossible to do this well without in-person exposure. In fact, surveys of program directors demonstrate that 2 out of every 3 applicants have their position on a ranked list changed after an in-person interview. And from the applicant perspective, there are myriad benefits associated with in-person interviews. Firstly, you get face-to-face time with future co-residents. You get to observe how they interact with one another and see how they are in their normal setting. You also get to interact with faculty to get a feel for the nuances of the learning environment and the culture of a program that you might be committing to. And lastly, prioritizing fit for your support system. Many people move their partners during residency, and an overlooked aspect of resident wellness is how well your support team is also supported. Your loved ones deserve to evaluate their fit in a potential new home as well as you. For reasons such as these, less than half of surveyed fourth-year medical students confidently believed that they could assess their fit in a program after the conclusion of the virtual interview.
Thanks, Beth. The second chapter of our argument focuses on the volume of applications and the distribution of interviews that resulted as our lives went virtual back in 2020. Across all specialties, the average number of programs that each applicant applied to increased from 35 to 48 back when residency interviews switched from in-person to virtual. And the average rank list length for programs and for matched applicants both had substantial increases between the interview seasons of 2020 and 2021. In one field in particular, applicants applied to 18% more programs, and programs extended 20% more interviews. Not all fields were impacted the same, and although these statistics are certainly getting better as we move into the 2022 interview season, the supply and demand relationship that governs how many programs that each applicant is able to apply to has been imbalanced by removing the logistical barriers to interviewing. And this is important because it impacts the way we review applications. So over here at Stanford, we're really good about holistic review, but there are a lot of other programs out there that are trying to adhere to the AAMC's holistic review recommendations. And as these programs get more applications, doing a holistic review takes a lot more time and it's harder to do. And while not every subspecialty has seen an increase in the number of applications, these factors could force many programs to rely more on numeric cutoffs, which would be us taking a step back in academic medicine. Now, Beth is going to talk a little more about how the imbalanced distribution of interview invites has contributed to what many have termed interview hoarding.
Thanks so much, Aydin. As Aydin said, practically speaking, virtual interviews have allowed people to apply to more programs and accept more interviews without substantially increasing the time and cost invested. Previously, these were important limiting factors. And this can be seen again in the substantial increase in the average length of rank lists seen when comparing pre- and intra-pandemic application cycles. This process disproportionately favors certain applicants, and I'll explain why. Picture this. You're a competitive applicant and you receive interview offers from nearly every program you've applied to. And due to the convenience of virtual interviewing, you can accept them all. No longer constrained by time and cost, you interview at almost every single program who's extended an offer. You interview at top programs, your mid-tier programs, and even most of your quote-unquote safety programs. This robs other applicants of the chance of an interview at some of these mid-tier and other programs. In an in-person cycle, when top applicants declined some interview offers, these offers would have then opened up mid-cycle to other applicants in a phenomenon colloquially called the interview trickle. Interview hoarding places undue stress on other applicants who are already navigating this high anxiety process. As Drs. Umeh and Abadilla brought up, mental health and well-being is definitely a huge factor that plays into this very high stakes and high stress process. Moreover, programs are investing valuable faculty time, finances, and interest in interview spots that might be filled with applicants who already know they are less likely to rank these programs favorably in favor of other programs. This is not pontification. Studies are showing a greater standard deviation in the number of invites received and the number of interviews attended pre and post virtual interviewing. In an open letter, the AAMC states, There is a maldistribution of residency interview invitations. We are seeing students in the highest tier receiving a larger number of interviews per person than in past years, leaving other students, including those in the middle of the class, with fewer interviews than we would anticipate based on their qualifications. Overall, virtual interviews widen the disparity between categories of applicants and programs.
Lastly, let's wrap up by critically analyzing what virtual interviews actually accomplish. So if you think back to our experience from the height of the pandemic, most of the benefits of virtual interviews came from cost and convenience factors. And there's no questioning that. You're never going to make a cross-country flight cheaper than a Zoom link. It's not going to happen. But if you step back and ask yourself, what's the purpose of an interview? I think then we start to get some of the perspective that shows us that virtual interviews don't actually perform when it matters the most. And there's good evidence to support this. Each year, the NRMP does a survey of program directors, which I'm sure many of you have read. And specifically among pediatric program directors, the top 3 attributes that contribute to success in residency are communication skills, ethical insight, and professionalism skills. And the data shows that virtual interviews make it hard to gauge these types of qualities. Approximately half of PDs found that the virtual format made it harder to assess applicant interpersonal skills in alignment with the institution. A majority said that the virtual format made it harder to assess the applicant's understanding and interest of the program, making it hard to determine who'd be the best fit. And in addition to these people skills, a third said that the virtual format made it hard to assess the applicant's competency as well. These factors are really important because the in-person interview performance has been shown to be predictive of good clinical performance and standardized test scores in residency. As with everything in the post-pandemic world, we might be getting better with how we do virtual communication interviews, but these critical attributes to success in residency should remain better served with in-person interviews.
Hey, what amazing, amazing opening remarks from both sides. We now will have a chance for rebuttal. We'll have start with our pro side and have 7 minutes. Take it away.
Thank you for your very valid arguments. To respond to the first argument that they posited in terms of virtual interviews not giving applicants a real-time feel for the place that they're interviewing at, and on the other side of the table, programs a real in-person feel for applicants. In recent years, partially spurred on by the isolating nature of the pandemic, we've seen an enormous growth in the potential of social media and virtual presentations to showcase the feel of an individual residency program. Short of feeling the actual California sunshine on one's skin, thanks to progress made in technology, one can be sitting in much colder Boston and figuratively feel how warm it feels to walk through LPCH on a virtual tour. And as we mentioned earlier, the virtual interview format really gives programs to showcase the ability to showcase other parts of their program and not just the home base. The virtual format makes it much more feasible to show how special our continuity patients at Gardner are, or how busy and very exciting our Fresno ED is. And this just helps give a more variety, a more various look at programs. Moreover, assuming that one may not get a good sense of program culture in the virtual format may be just that, an assumption. There are studies that refute this. A 2021 study among orthopedics residents, which had participants take pre and post surveys about the virtual interview process, showed that virtual interviews allowed applicants to assess programs' culture better than they initially expected. Finally, the NRMP recently, just this past Wednesday, closed their public comment period regarding a program called the Voluntary Locking Functionality of Program Rank Lists. With this initiative, virtual interviews would still take place with all of the advantages that we explained initially. However, programs could submit their rank lists and then lock them. Thus, applicants would be given a chance to visit programs in person, getting the real-time feel and vibes of a program and the program's residents before submitting their own rank lists. This provides a more equitable second look opportunity such that applicants would still be able to get an in-person feel of a program of the location.
Thank you for that. To our opponent's point of interview hoarding and saturated interviews, it's a fact. That's a very valid point, and I can't necessarily say that is incorrect. However, our opponents raising that fact don't identify that interview saturation is inevitable. We know that because it's reflected in the NRMP 2023 match results this year, there are 42,952 certified applicants. However, there are only 40,375 available residency positions. This upward trend in applicants is only set to continue, and we've seen that at this rate, there will outpace the amount of available residency positions. So it is inevitable, whether interviews return back to in-person or virtual, the amount of medical school graduates doesn't necessarily equivalent to the amount of residency positions that are available. In addition to the topic of interview hoarding, yes, because of virtual interviews, you can be in Chicago and California a few hours apart. However, virtual interviews are not perfect, neither are in-person interviews. That being said, one of the topics being discussed right now is as well as the topic of capping, which would limit applicants the amount of interviews that they're able to have access to, giving the other non-top tier applicants an opportunity to still have those interview positions.
And then to our opponent's assertion that virtual interviews help programs or do not help programs show how people's interpersonal and communication skills are, there is quite a dearth of evidence firmly supporting that assumption that this is true. There is a study in the American Journal of Respiratory Critical Care Medicine that showed that between in-person and virtual interview cohorts, pre-pandemic and during the pandemic times, virtual interviews actually led to higher ratings of applicants in the interpersonal skills category, a difference not seen in other categories such as clinical skills. And also, we actually posit that virtual spaces give programs more opportunities to mitigate biases against certain applicants, as well as perform a more holistic review. These opportunities are such that we can require virtual backgrounds and help perform technology checks. And in the virtual format, we are able to more easily facilitate multiple mini interviews with more variety and diversity of interviewers, which has been shown to mitigate individual rater implicit biases and be able to more effectively perform these holistic reviews that they so clearly said were important in the interview process.
And lastly, in suggesting that the applicant population is not as diverse, we've seen in data that for DO and IMIG applicants, the virtual interview actually offered a more successful match rate, having gone from in-person to virtual. So that's where our opponents point that we are disadvantaging more marginalized communities. This is actually not the case, and arguably so, these populations have been benefiting from virtual interviews. Thank you.
Okay, thank you for your rebuttal. We'll pass it on to our con side. They have 7 minutes.
Thank you so much, Doctors Umeh and Abadilla, for those excellent remarks. I first wanted to address your excellent points about equity. And I think Aydin and I both absolutely want to echo the importance of equity in making sure that our systems are equitable. However, we do have concerns that while striving for equity in the virtual interview space seems like leveling the playing field or elevating disadvantaged applicants, we worry that it actually places further undue stress in other parts of the application cycle, thus worsening inequity. We believe that people are still recognizing the importance of in-person exposure, that they're realizing that the virtual interview space does not help them put their face at an institution, get their feet on the ground. And thus, we've heard colloquially that away rotations are becoming more and more important to applicants as they try and land in a space, get to know co-residents, and get to know program leaders. In this situation, we would actually argue that the stress that is now being placed on other forms of in-person exposure, like away rotations, is actually widening the equity gap. People are being forced to pay for months of housing out of pocket, for transportation to and from an away location place, and paying out-of-pocket cost of living. And so the people who are able to do these are applicants who maybe have a little bit more privilege, a little bit more resource. And we find year and year again that people who do things such as away rotations match at higher rates to institutions which they have attended. And so ultimately, we do worry that while having virtual interview spaces seems to level the playing field, it actually will disadvantage applicants in other ways. We also want to point out that, yes, saving money is absolutely so important. We've already spent so much money on medical school and our medical education and our undergraduate education. And we again strongly argue that interviewing is a very important juncture. You're deciding where you might want to spend the next chapter of your life. And overall, it's less than 2% of the cost of medical school alone that averages out to the interview process. We also 100% wanted to echo thoughts about disability and thank our colleagues for bringing that up. But I would actually argue for our colleagues with disabilities that being in person is more important than ever. I think being on the ground and looking at the accessibility of the facility you're looking at, seeing whether or not the space and the people in it are able to create a conducive learning environment for you is actually more important and something that you really cannot get in the virtual space. And we also wanted to point out from a diversity standpoint that while you might be able to talk with more faculty of diverse background virtually, there's nothing quite like walking through an institution and seeing people who look like you, seeing representation on the ground and imagining yourself in a space and seeing whether or not that space is a place where you are going to feel comfortable and supported. And lastly, we also wanted to talk about the interview capping as a potential resource for interview hoarding. Our concerns are that there are in terms of contiguous ranks, the length of rank list that's been shown to have a successful match, it's very variable across specialty, across whether or not you're an osteopathic colleague or, as our colleagues pointed out, an IMG. How do we set those caps? Are they different for people? What about people who are going to partner match? What about people who are applying to a different geographic location? How do we really explore the nuances of this and make sure that we're setting cap at a place that does not make the match more difficult and more stressful for people? If someone goes unmatched because they hit that cap, I think it would be a very difficult thing to fathom.
Thanks, Beth. And back to our equity point too, I think we also need to think about equity of smaller community hospitals too. I think at big academic centers, we will very often have a plentiful amount of applicants, but a lot of times smaller community hospitals need to show in person the type of community that they have to recruit applicants and show how great of a program that they are. A lot of times you can't get that virtually with a lot of the facts and figures. Additionally, with cost, yes, we 100% agree that the environmental impact of interviews should not be ignored. And I think everyone in this room can agree that we want to do everything we can to sustain the environment. But if you really look at the numbers, the impact of interview travel for med students accounts for 1/100th of the annual carbon emissions of the healthcare system as a whole. So yes, it's totally important for us to think about that as we think versus in-person versus virtual interviews. But if that's going to be the driving factor, I think we should think about what the actual impact of the differential impact is. Lastly, when we talk about flexibility, I think, yes, really helpful to have like more time at home and be able to attend interviews at your own leisure without having to spend the time of traveling. But a really nice thing for us to reflect on is since the pandemic has thankfully gotten better, knock on wood, how many of us have been to an in-person conference? And how much better was that than being at a virtual conference? How many business cards did you get at a virtual conference? How many emails did you get on a Zoom chat? And how much better was it in an in-person conference? I think those things are really important things to remember. And the med students are getting that exact same experience when they go in person. And I think that we should really be careful about overplaying the convenience argument and think about, what is the actual outcome that we're trying to achieve.
Okay. Amazing points all around. So this is the moment we are actually going to pause before we do our closing remarks and have a moment to take some questions. Quick rules. We ask that you ask questions rather than your own commentary. And the goal is to take at least 2 questions, but for the sake of time, we ask that you also be concise, and I will cut you off if you start offering your own commentary. Any questions?
I think that's an important point that favors a lot of the flexibility of virtual interviews, because a lot of the time that you spend traveling during 4th year sometimes amounts like a month or more. And that's a lot of time that's spent away from clinical rotations and exposure that could prepare you quite well for residency. I think, balancing off of that, however, a lot of medical schools have built-in flexibility time in the 4th year. And a lot of that is for career development as well. So I think that the in-person interview experience that takes away maybe from some clinical time contributes more to the professional development goals of the 4th year of med school. So I think that that's something that really needs to be taken into account. Although certainly, time away from the institution by traveling is definitely not ignorable.
Thank you for that point. To the point, in literature, it did suggest that urology residents actually averaged about 20 days away from in-person clinical rotations to attend in-person interviews. That being said, people need to be cognizant of fourth-year medical students still pay a full tuition for their fourth-year medical school. So to say that they're attending in-person interviews, paying for the additional cost of traveling, while also simultaneously paying a full tuition is not fair to medical students if we're speaking about equity. I understand that in-person interviews does benefit being able to see where you are going to school. However, medical school, medical education promises medical students 4 years of a curriculum. And I think that should be respected in terms of thinking about their future as well.
Okay, we have time for another question. Anyone in the room? Dr. Namjoshi.
Might be an ignorant question. The reason it has to be either or, there's a reason sorry. Is there a reason virtual interviews to increase
the mic. The question was the either or is like the question about having a choice in the process of virtual or in person.
That's an amazing question. And it's something that's actually being considered and discussed, which is the topic of hybrid interviews. The question to ask yourselves is, if you're at a party and you mentioned that 10 person would be in person and 10 people were going to attend on Zoom, who would you interact with more? The people that came in person or people who are on Zoom? Same thing for applicants. If I knew an applicant from DC came to California versus few applicants in DC attended on Zoom, I would argue that the people who came in person cared more. So if we're talking about the topic of equity, we can't necessarily say that it remains respected in the hybrid setting because your bias does tend to go to applicants who wanted to be in person, who wanted to give you their finances to make sure they attended in person, which creates the difficulty of hybrids being successful.
I meant like a stage thing where it's like a so first virtual.
Dr. Namjoshi just clarified for folks on Zoom that she meant like a staged process. So like in tiers of like a virtual then in person.
Yeah, I think that's like a why not both. Exact. That is what you were asking, Dr. Namjoshi. And I think we both agree because we both have had great pros for in-person and virtual interviews. And if there was a way to do it perfectly such that the equity that Dr. Umeh mentioned is still, enforced or encouraged, that would be the ideal situation, I think.
Yeah, I totally agree, especially if it's like a broader catch at the virtual stage and then maybe in-person interviews later on. The one thing that I would caution with that, especially with kind of the logistics, is like how much faculty time are we willing to devote to these interviews too? And I think like that's like an evolving target, that would, that would have to be a consideration.
Thank you. That was a very helpful question, Dr. Namjoshi. And to build on that, I'm curious, how important do you think it is that an entire specialty do the same thing? Or could some pediatric residency programs choose to offer in-person interviews, whereas others say we only offer virtual interviews, but consistent within that program?
I think it's important that an entire specialty do the same thing, because then that levels the program, like the playing field for all programs. Kind of what Dr. Umeh said, if there is a party and there are people in person and then over Zoom, you're gonna gravitate towards the in-person just because of our personal and human biases. But I feel like it will be very nuanced because I particularly am in a combined program. So I had to interview with pediatrics as well as neurology. And I think that would offer some kind of complications. Additionally, I feel like if certain specialties go to virtual and certain specialties go to interview in person, some people actually apply for multiple or are thinking of multiple, and that may bias people in certain ways. So I think that it is very important for programs to be the same across the board.
I thought that was a great response.
Okay, I think we have time for one more question. Dr. Kian.
I know we talked about interview recording.
Is this on? Okay. I know we talked about interview hoarding and trying to avoid that. Is there any data for applicants of like a lower socioeconomic background, how many interviews they are limited to
with in-person interviews? I know we're talking about people taking too many virtual ones, but is there information out there about how people are limited to too few in a non-equitable, unfair way? I think that's a really good question. And frankly, that is data we searched very hard to find. I do think some of the barriers we're coming up against is that this is a very sort of new, brave new world, a new phenomenon that's been thrust upon us because of the pandemic. So the data is very new. And in terms of hybrid models and away rotations, I think year by year, things are still evolving at a very rapid rate. So unfortunately not, but that's a really good point, Dr. Kian.
I think that was a very good plug for interns who are considering the stat advocacy track or the med ed tracks, because that would be a very, very good research project.
Okay, thank you all so much for your questions. We are now going to transition to our closing remarks. We'll start off with Dr. Umeh and Dr. Abadilla.
Virtual residency interviews represent a progressive step forward for the future of medical training. It is evident that virtual interviews have the ability to create a more equitable environment for applicants through significantly reducing the financial burden, minimizing bias, and increasing accessibility for marginalized populations. When one thinks that they need to be in person to get a true feel of the program and feel like there are people who look like them at the program, we would posit that interview teams are already self-selecting. Virtual interviews create more convenient ways for faculty and residents to turn out for these teams. And one would say that if during virtual interviews they don't turn out, that would be a clear and heavier answer about whether or not people in the program look like them. The increasing accessibility or the pandemic has demonstrated that virtual interviews are both feasible and effective ways to evaluate applicants and choose great residents. I mean, many of us here and online are the product of virtual interviewing today.
We recognize that the system is not perfect, but a lens of perspective that warrants a full consideration. We have the duty to physicians to continue advancing medical training and protecting our patients. Returning to in-person interviews would risk a great disservice to the future of medicine. Virtual interviews have the ability to exacerbate disparities in medicine, but if used correctly, it could be a powerful tool in attaining equity. In speaking of equity, I'm the product of an underrepresented funded minority program called SCORE that Stanford offered, which is one of the only reasons I chose to come here for my residency training. To suggest the disparities, there are ways to mitigate underrepresented applicants attending away rotations to better see where they're going for the next few years. We hope that with the time we spent with us today, we've been able to move forward and to confidently say that virtual interviews can lead to a brighter, more inclusive future for medical trainees.
Okay, and lastly, Dr. Yan and Dr. Zahedivash.
Thank you so much. Ultimately, the decision of where to attend residency is an enormous one. This decision not only dictates where you will spend an entire season of your life, but has implications that will ripple through your professional and personal future. Applicants deserve access to accurate, holistic, and personalized information regarding how they may fit into a program and its culture. This is impossible to gauge without in-person interviews. As we have shown, data demonstrates that neither applicants nor programs feel confident in the decisions made off of virtual interviews alone. The inability to as accurately assess personality traits, culture match, and the intangibles that come with in-person interactions means that we are doing ourselves a disservice by keeping interviews virtual. Our colleagues have accurately pointed out that virtual interviews are a more frugal and flexible option. And while we agree and join them in advocating for decreased barriers to medical education, we strongly believe that foregoing in-person interviews is a detriment to learners. At the juncture between medical school and residency, prospective residents have already invested an incalculable amount of time, finances, and opportunity costs to pursue a career in medicine. It would be illogical and frankly unfair to hinder applicants from evaluating whether or not a program is the right fit for them while marketing this as a cost or time-saving maneuver. In reality, this cost is a singular drop in the vast expanse of what we have already sacrificed in the pursuit of medical education. Instead, we should pivot our focus to ways we can identify and support applicants with the greatest need of assistance, with the goal of making in-person interviews more accessible and equitable for all.
Zooming back out, ultimately, the implementation and advancement of patient care at an academic hospital is dependent upon having residents who embody and perpetuate the ethos of the institution and who are a good fit for the learning environment and gel with other members of the institution. While these characteristics may be arguably some of the most important in recruiting a residency class, they're some of the most difficult to gauge. Given that virtual interviews are worse at judging critical people skills and that are necessary to do well in residency, and they diminish the quality of interaction that some faculty have with members of the applicant class, continuing with the way we are is clearly not the best for programs either. Given the amount of time that we as an institution invest in recruiting new applicants, we need to make sure that we're using our time and resources wisely. So we really need to think extra critically about whether keeping with virtual interviews is actually better, or if it's just us being complacent with the convenience of Zoom life. Thanks.
Wow, you guys, thank you all so much. Let's give another round of applause to all 4 of our amazing participants. The 3 of us are so proud to see you all share your ideas and regardless of, I know we view this in this polarized way, but I think out of this conversation just comes great ideas about how we mitigate, the downsides as we go forward with whatever system we are on. Okay, so here we're gonna try again. I think I fixed it this time. I apologize for the poll issues earlier, but let me activate.
Standard deviation.
But again, this just points to the complexity of this issue, and thank you all for sharing your incredible thoughts and ideas.
The preceding program is copyrighted by the Board of Trustees of the Leland Stanford Junior University. Please visit us at med.stanford.edu.